Tracheostomy is a surgical procedure which is created at the front of the neck so a tube can be inserted into the windpipe, so patient capable to breathe. If necessary, the tube can be connected to an oxygen supply and a breathing machine called a ventilator. A tracheostomy may be temporary or permanent, depending on the reason for its use. For example, if the tracheostomy tube is inserted to bypass a trachea that is blocked by blood or swelling, if it will be removed once, regular breathing is once again possible. Can you breathe on your own with a tracheostomy? Yes, many people can breathe on their own with a tracheostomy. Because tracheostomy bypasses your nose, mouth and throat, it allows air to go directly into your lungs. In the event that you are unable to breathe completely on your own, your tracheostomy tube can be attached to a ventilator or breathing machine. After surgery, your neck may be sore and you may have trouble swallowing for a few days. It may take 2 to 3 days to get used to breathing through the tracheostomy tube. You can expect to feel better each day, but it may take at least 2 weeks to adjust to living with your trachea. The medical survival after tracheostomy with 21 months. The survival rate was 65% by 1 year and 45% by 2 years after tracheostomy. Survival was significantly shorter in patients older than 60 years at tracheostomy. Having a tracheostomy usually will not affect the patient's eating or swallowing patterns. Sometimes there are changes in swallowing dynamics that require adjusting to, but it is rare that this cannot be overcome in a short time. God bless you. Stay healthy, stay safe.